The Health Minister says that he's pleased with the readiness of Mpumalanga to fight the spread of COVID-19. Dr. Zweli Mkhize was speaking to reporters after his visit to Ermelo. Our reporter Tumela Machoho was there and told us more about what the minister said.
Well, the Minister of Health, Dr. Zweli Mkhize, visited Mpumalanga today. He was in Ermelo actually to check on the progress of testing and screening of people for COVID-19 in this province. He also said that he was very, very proud to see that a lot of people have been screened actually in the province, and also a lot of people have also been going out there to test. He also spoke a little bit about saying that actually this province is ready to deal with this COVID-19. He was speaking to physicians, doctors, and also to MEC and also the MECs actually to this in this province to actually see how ready they are. But he says the province is ready. Take a listen.
We're very happy with the plan. We also must say that although the numbers have not grown very high in Mpumalanga, we're actually quite conscious of the fact that there may be no warning of this infection, and so it's important for us to be able to meet the health workers, the doctors, the nurses, and the various clinical disciplines, and say to them that we really want to support them, and they must know that all the time, whatever they are doing, we are looking out for their interest, in particular to make sure that they are well trained, to make sure that they are well prepared, they are well protected, and so we want them to be always, focusing on our strategy of going out to screen communities, to test communities. We've now been very pleased to see that at this point they've screened about 94,000 members of the community. They need to keep pushing these numbers up, and they've already done over close to 500 tests out of that process. And so we need to keep the numbers up, because we have said we want to go out and discover people before they even get to our hospitals. That's the way we want to reduce the pressure on our health services. I'm very pleased to therefore see that that's exactly what's being done in Mpumalanga. And when we looked at the list of their COVID positive patients, the large number of those would have come from people who have been traveling, and a few of them are contacts, and really we're hoping that we could be able to contain this infection in a number of areas. Particularly our concern is internal transmission, where we would like people to heed the call from the president that people must stay at home, people must wash their hands, people must use the mask, and we want communities out there to use masks, and cloth masks are very, very effective, and so they must continue using them.
The minister also went on a door-to-door campaign, actually encouraging people to go out there and start screening for COVID-19. He spoke to a lot of people and also went and visited a couple of households. Let's now speak to the people actually who the minister actually spoke to, and people who actually went out and started screening for COVID-19. Ntate Fani Masibuko, Madonsela, Ntate, just talk to me. Untshele ukuthi lifila kanjani ukuthi uminister ufikile na bali screenile na Ermelo.
Mina ngizizwa ngijabule kakhulu ukufika kwababa uZweli Mkhize. Kokungijabulisile ukuthi ngendlela abafike ngayo vele besisenkingeni ngalesifo esivumbukile iCovid-19, singazi ukuthi sizobaleka sishonephi ngenxa yalesifo basigcwele umhlaba wonke. Kodwa ngoba kufike bona sesinethemba ukuthi hayi sizosinqoba, ngoba besilokhu sizwa ngohulumeni wethu athi sihlale ezindlini, isikhathi esiningi sigeze izandla, kume yonke into njengalento abayibiza ukuthi umsebenzi umisiwe. Ngempela sihloniphile umthetho kahulumeni, senza lokho. Sinamathemba ukuthi sizophumelela lesifo, sizosinqoba masibambisene. Nabasekudeni ngezukuthi nabayibona lento bangazama ukugwema, balandele umthetho obekiwe. Ngempela sizosinqoba lesifo, sibambisane nohulumeni sonke, kungabi nomuntu obona ngeliso elingasilo, lingaseradele.
Ntate Madonsela actually talking to us about how the community must work together with the government to actually curb the spread of coronavirus. He actually said that they've been staying at home, they've been obeying the rules of the government, especially regulation that have been in place by the government to make sure that the people stay at home and they continue to stay at home. But they've also been screened by the health officials. So he's very, very happy about that. Let's speak to another gentleman. When Mduduzi ufila kanjani ukuthi ufikile uMEC ominister nam MEC baliscreenile lifila kanjani ukuthi baliscreena la emakhaya enu?
Sijabule kakhulu ukuthi manje ke uminister asilethele bonke abantu ukuthi manje ke nabazoscreena labo namanesi nalabo dokotela. Sijabule kakhulu ngoba vele lowo besolo kusikulindele ukuthi manje ke kube khona usizo esilitholayo ukuthi sihlolelwe legciwane ngoba siyabona mhlaba wonke legciwane liyabulala. So sijabule kakhulu nje ukuthi manje ke kube khona nje manesi angene door to door ascreene. Siyajabula nje ukuthi manje ke nala Ermelo awekho ama cases akhona esinawo ngale corona. Kusho kona ukuthi abantu bayiphatha kahle, bayilandela imigomo, bayigeza izandla yonke nje lento. Yeah, sijabulile nje ngaloko. Sengathi nje uminister angaqhubeka nje ukuthi ahlole nje abantu ukuze kwazi ukuthi manje ke nasikhona ukuthi silwe nalo legciwane ngoba siyabona ukuthi vele lamhlabeni legciwane libabulala kangakanani abantu. Sibambane futhi nathi sibantu.
Also, the same sentiment coming out of Mduduzi, they're saying that, you know what, they are very pleased with the government to actually come out there and start screening people. They've been screening a lot of people in this community because, you know, township are actually areas where people are actually congested, like a lot of people. This is where actually the spread could easily spread. But right now in this area, there have not been any case of corona being reported here. But the people here, they are concerned that the coronavirus is spreading worldwide. So they are not immune to this as the community of this the community here, but also they're saying they're taking precautions, they're going out there, they're washing their hands, they're protecting themselves from this COVID-19. Back to you.
That was Tumela Machoko reporting.